Hello guys, welcome to my channel Nurse's Voice, only for health education and information. Today we discuss about a very interesting topic, CPR, the cardiopulmonary resuscitation. Then it's related to cardiac arrest, right? Oh my god, cardiac arrest. When we think about cardiac arrest, then we fear about that and think, why do cardiac arrest happen? Can you survive cardiac arrest? Then it goes to CPR. How to perform CPR? How long should CPR be done? Can I give CPR to someone? Etc. etc. So don't be anxious about that and let's start to know about the CPR. Cardiac arrest. Sudden unexpected loss of heart function, breathing and consciousness. In cardiac arrest, the heart abruptly stops beating without prompt intervention. It can result in the person's death. If not treated immediately, sudden cardiac arrest can lead to death. With fast, appropriate medical care, survival is possible. Giving cardiopulmonary resuscitation using a defibrillator or even just giving compressions to the chest can improve the chances of survival until emergency workers arrive. Resuscitation CPR. Cardiopulmonary resuscitation is a life-saving technique useful in many emergencies, including a heart attack or near drowning, in which someone's breathing or heartbeat has stopped. The American Heart Association recommends that everyone untrained by scanners, a medical personnel, alike begin CPR with chest compression. Before starting CPR, check: is the environment safe for the person? Is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person does not respond and two people are available, have one person call local emergency number and get the AED. If one is available, and have the other person begin CPR. As soon as an AED is available, deliver one shock. If instructed by the device, then give in CPR. At the time of giving the cardiopulmonary resuscitation, use 3C: check, call and care. Now the 6 steps of CPR. Check if conscious or unconscious. If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" Then open the airway and check breathing. Prepare to give to rescue breath. Give the first rescue breath lasting 1 second and watch to see if the chest rises. If it does rise, give the second breath. If the chest does not rise, repeat the head tilt and chin lift maneuver and then give the second breath. Fourth, check the pulse. Carotid pulse present in between the trachea and the sternocleidomastoid muscle. If pulse found, then do not go to step 5 and 6, and no pulse, then chest compression. Landmark for hand position. Place the heel of one hand over the center of the person's chest in between pressing nipples. Place your other hand on the top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. You push straight down on the chest at least 5 cm but not greater than 6 cm. Push hard at a rate of 100 to 120 compression per minute. As soon as an automatic external defibrillator is available, apply it, administer one shock, then resume CPR and starting with chest compression. Continue CPR until there are signs of movement or emergency medical personnel take over. I hope you will enjoy this video. If you like this video, then like and subscribe this channel. Thank you.